Microphone, Steve.
Welcome, everyone. Thank you for joining us for today's webinar on the establishment of community-based daycare in Cambodia. My name is Steve Barnett. I'm chair of the award committee for the Khalifa International Award for Early Learning. This webinar is sponsored by the Khalifa Award. We are joined today by Stephanie Zell and Sophie Mao of the Planète Enfant et Développement, a 2025 winner of the award for Best Program. The Khalifa International Award for Early Learning was founded in the UAE to recognize excellence in research and practice and programs in early childhood education as a means to elevate the importance of strong early childhood education globally and to recognize the best in research and practice that can be used to influence and improve policy and practice globally. The award was established under the direction of His Highness Sheikh, excuse me, I have a little bit of a cold, Sheikh Mansour bin Zayed, who's the United Arab Emirates Vice President, Deputy Prime Minister, and Chairman of the Presidential Court and Chairman of the Board of Trustees of the Khalifa Award for Education. Today, I'm pleased to have our guests with us. They will speak make a presentation for about a half an hour, at which time we'll have opportunity for the audience to raise questions that I'll moderate through the Q&A. So please put your questions in there as they arise or on the completion of the presentation. And I think we'll have plenty of time for those. The webinar will be recorded and available on the Khalifa Award YouTube site. And without further ado, I'll turn it over to our speakers today to introduce themselves and make their presentation. Thank you.
Thank you very much, Stephen. Very honored to be here and to have been distinguished by the prize. So my name is Stephanie Zell. I'm the director of Planète Enfant Development in Cambodia. I've been working in Cambodia for 5 years and in the same organization for 20 years. And here with me is my colleague.
Yes, good afternoon, everyone, or good evening, everyone. I'm Sapos. I'm the project manager of Community-Based Childcare Center. I work in the field almost 15 years on the early childhood and development sector.
So we will go into the presentation we prepared for you. So first of all, few words. Sorry, it doesn't work.
Just here.
Huh?
Just here.
Sorry, I didn't share the presentation, so I have to share the presentation. It's a good point. Yes. Yes. Thank you. But still the slide doesn't go. Yes. Yes, so just a few words about our organization. It's a France-based international NGO. You can notice by the name, of course. We've been working for more than 40 years in Cambodia and generally internationally. we work on different topics or different priorities. And the first one is the ECD, the early childhood development. But we also work for the, let's say, the blossom and the well-being and the protection of the children through family development support, protection against violence for women and children, essentially, social and professional inclusion for also women and young people, maternal and child health, and last, advocacy. And we work in 8 countries, in Cambodia, Vietnam, Laos, in Nepal and India, in Togo and Burkina Faso, and in France. If I focus a bit on Cambodia, we've been working there from the beginning. The NGO was founded in Cambodia at the beginning, and we did the nutrition program in the orphanage of Phnom Penh just after the end of the civil war. Then we focused our action more to professional training and to the support of the Ministry of Education. Because after the war, as you know, all the system has collapsed, and we had to, all of us, I mean, international development partners, NGOs, government, locals, to join our forces to build again the educational system. More recently, like nearly 20 years ago, we also created a scheme which is a community preschool scheme, which was not existing at that moment. And the objective was to improve the access and the quality of schools for the age between 3 and 6 years old for the children. In 2004, we had set up the 100s, sorry, CPS in Cambodia. And in 2017, we began to work more specifically on the childcare centers, so for children below 3 years old, because the need was really important. And we began by a pilot in a company in factories, which was a bit challenging and for different reasons. But one of the reasons was that it was a bit difficult for the families and especially for the mothers to transport their babies from their village, from their home to the factory. And so that's why we decided more recently, 6 years ago, to design a new model, which is this CBCC, this community-based childcare center model, which is now the first model of public daycare centers in Cambodia. And so in 2024, but also in 2025, we have 13 operational CBCC in 2 provinces of Cambodia. And so I will let the floor to Support to present you the background more precisely and the services of the CBCC.
Thank you, Stephanie. So I would like to present about the introduction and background about CBCC, Daycare Center. So in the government industry, strive Cambodian economic. You see, roughly more than 80% of Cambodian total export revenues in 2019 and provide job more than 800,000 workers, and approximately most of them were women. And anything, there are many factory workers face challenges to access safe, affordable childcare, especially for children under 3 years old. Most of children were living with their grandparents and also all their relatives during working hours. And we learned that new mother often did not return to work after their end of maternity leave, although a large number later returned to work when the children were older. And another situation about the law. The law requires factory with over 100 female workers to provide childcare, but the enforcement is weak and few comply. Based on the assessment conducted by International Labour Organization found that many factories were not comply, and with complying enterprise elected to provide a small care allowance. And also, the law also cover only children age 18 months to 36 months. Another reason about the government program mainly target to children age for 3 years to 6 years, but leaving behind infant and toddler without formal education care. And the next slide present about what type of service that childcare provide in our daycare center. Basically, CBCC provide a service based on nurturing care framework. As you know, it's nurturing care framework that consists of first about the nutrition. Actually, CBCC provide prepare the 3 meal per day. That this meal it will be follow according to the Ministry of Health nutritional guideline. Another one about the responsive care. All of our caregiver that provide the service in daycare center receive 25-day training and followed by the regular coaching and monitoring to ensure they provide the quality of standard and provide responsive care to the daycare center, to the children in daycare center. And other about the security and safety, it, daycare center was designed and operate in alignment with establishment of the quality standard and also ensuring both physical structure and caregiving practice promote a safe, nutrition, and stimulating environment for children. And the third one is about opportunity for early learning. As the daycare center is provide service based on learning through play, that a learning through play approach encourage children holistic development through the interactive, enjoyable, and age-appropriate learning experience. And for the last one about the health, regularly every month, the health center conduct the course monitoring, or we can say health checkup to all the children who are enrolled in the care center. This approach is to ensure for early detection of any issue or detect the health issue and promoting overall or child well-being in the daycare center. And the daycare center provides 6 days per week, and from 6 a.m. to 6 a.m. 30 to 4 a.m. p.m. and possible to extend based on the schedule of working parent. During the implementation, we identify 3 challenges. The first challenge is about the occupational rate. As the data present in our monitoring tool, so that there was a slow child enrollment. That is related to, it can be related to cultural preference for families-based care, especially many of family, especially living in a rural community, they prefer children to be cared for by their relative, especially for the grandparent. And number 2 is there can be lack of trust in CBCC because of the concerning about the quality of care, violence on children, safety, and staff qualification. Finally, the poor infrastructure and inadequate transportation make it difficult for family to access this center and further contributing to the low enrollment rate. So based in this challenge, we learned that enroll a child in a daycare is a deep social cultural change behavior, and it takes a lot of time. And based on this, in order to improve the child enrollment, information must be conveyed through several complementary communication channel, such as door-to-door, factory-based event, the event in the village, as well as through the village leader. And we have learned that most testimony about daycare center service is the best boost for children enrollment. And the next challenge is about the technical sustainability. As a new professional need to be established to support long-term quality and consistency in the childcare service. So initial training alone has proven insufficient to ensure the delivery of quality, and experience so that ongoing coaching, regular follow-up, and refresher training are essential for maintain and improve sustainable standard. In addition, new caregiver need to prepare initial training upon recruitment. From the technical aspect, sustainability, we learned that the ministry of education should include coaching, follow-up, and refresher training in the action plan, as currently it does for the other school in Cambodia. A child care center should be set up in order to provide opportunity for caregiver in public as well as in the private sector to be done and scale up the program. And the last challenge is about financial sustainability. We face in the sustainability of the financial in the care center, but the long-term financial sustainability is on the right track. And you can see in the figure, a chart. Currently, the parent pay $45 per month to cover for one child. And this amount of parent pay for daycare center, it can cover around 50% of total operation costs. And the daycare center also receives some contribution from the commune as well as the factory and brand. So based on this aspect, and we learn about the financial aspect in daycare center, the community daycare center long-term financial sustainability can be achieved through sharing financial responsibility among the public and parent, even though the private sector should be contribute for the employee through the private childcare center. And so thank you. I would like to, for your following my presentation, I would like to pass the floor to the Stephanie for next slide.
Okay, thank you so far. So the next part is about impact and successes of the CBCC that we want to highlight. So CBCC, we found that it had many different impacts. First, of course, on the children, and we will detail a bit each component. So it has benefited to the children, it has benefited to the families, to the parents, but also to the factories, to the employers, to the communes where the CBCC are located, and also to the government itself. So regarding the children, the main easy, I would say, impact to measure is about the health. The main issue regarding the health in these provinces where we work is about nutrition. So we compared the average rate of underweight children in the province where we have the CBCC to the cases that we face in CBCC. And of course, I mean, hopefully in CBCC, we don't face any underweight situation or stunted situation among the children we take care of. And if we compare to the ratio in the province, it's really a nice impact because we face 22% of toddlers underweighted in Kampong Speu, one of the two provinces, and 18 in the other province. And 33% of toddlers suffer from stunted growth in Kampong Speu province, and nearly 23 in Kampong Cham province. So this is a first result that we could achieve quite quickly, and because we decided to cook on site. This is one of the characteristics that Sopor also mentioned, that we do 3 meals a day for the children, and we cook. We have a kitchen in the centers, and we trained specifically cooks in order to provide very balanced meals and suitable meals for children. So this is really a first result. Regarding the families, we just want to highlight also some impact. First of all, the income among the parents that put their children in the CBCC since it has opened. We identify that in average, the family have an additional income of $35. $35 out of an average salary, which is 300. So that makes a bit more than 10% difference in average, which is, of course, a lot. Of course, we also saw that it's opportunity or possibility for mothers, young mothers, to get back to work after the maternity leave, which is of 3 months in Cambodia. The family also are satisfied because they get more visibility on the expenditures. They have to pay $45, which is not nothing, but at least it's flat. They know that every month they have to pay $45, and they don't have to worry about the cost at the end of the month. They also face less unpaid working hours because there is less absenteeism due to the, for instance, sickness of the children. And of course, they also declare that they feel better. They feel a better well-being and a decreasement in their daily stress because they know that the children are safe, playing freely and happy at the daycare center. So it's a big relief for them. If we consider the communes, it's also a big new asset, I would say, for the communes. We created what we call advisory committees in each commune welcoming a CBCC. And from the beginning, we work very closely with them, and we coordinated with them to hand over. So we are handing over at the moment. Some of the management is already handed over, but so we train them on ECD, but also they are also responsible for the human resources management inside the daycare. We have 4 staff per center. So they are in charge of paying the salaries, they are in charge of contracting, they are in charge of recruiting new staff if there is a resignation, for instance. They also manage financially. So the project provided some money, but the commune were in charge of receiving the funds and paying all the salary, income, and all. They also do a lot of awareness in the communities, as we saw, to promote enrollment. They organize the growth monitoring with the public health centers, and they also are in charge of monitoring child development together with the managers of the CBCC through specific tools that we developed. The CBCC are really anchored in the communes, and this is one of the key of the sustainability. And so now the advisory committees, which are around 6 people per communes, are really well capacitated in managing the CBCC. Of course, we created also a bit of jobs for per CBCC, so totally 52. 52 positions. We increase the income for the community thanks to the parents. And as I already mentioned, we improve the well-being for families, and we provide another social service. For the factories, we also noticed, and we conducted interview to assess that they also benefited from the CBCC. First of all, that can be a point to highlight for the factories towards the brands, their buyers, and toward the customers of the brand. That contribute, of course, for let's say, for the most responsible factories to their CSR policy. that allows them to comply with the legal requirements because there is a law, but as Opor said, it's rarely followed. And also they face, I mean, they also gain into productivity, even if it's a bit difficult to assess, to be honest, because we have like 300 children we welcome from the beginning, but from maybe 20, 30 different companies. So it's very scattered. So it's a bit difficult so far to assess the gain in productivity of the factory, but at least what they said is that they face less absenteeism for the workers, especially from the mothers, and that the mother they focus more on the work thanks to a more serene day they have. And so they also have a better staff retention, especially among young women, which is also important in terms of benefit because it avoids them to hire new staff and to train them again and again. And last but not least, we know that it has a very important impact on the government of Cambodia. So on the right part, maybe a lot of people already know this famous curve and trend, which has been designed by James Ekman, the Nobel Prize of Economy, and he said that investing $1 in early childhood may lead to $6 to $17 in benefit for a country, thanks to better female employment, better skilled labor, saving on health, on violence, and decreasing the social cost of the government. So this is general. It's not only for Cambodia, of course, but specifically for Cambodia, what they like, and they keep repeating it, is that first of all, we developed in coordination with the government, with other stakeholders in Cambodia, we developed guidelines to operate CBCC, and that is now public. That means if somebody wants to open a public or private community-based center, he can base his work on these guidelines. So there are guidelines for management and guidelines for caregivers and guidelines for cook. We also developed the curriculum. So the curricula are ready for new caregivers to be trained. And that also helped the government to raise awareness about the impact of early childhood, which is quite new also in Cambodia. And we try to promote the early childhood development importance to be, to work for the blossoming and school readiness at the end of the children. So as an example, we have a Facebook page with 1,400 followers, but the people also spread the word around them. So that makes some job. Yes, I think this is my last slide before the question. So as a conclusion, we can say that what we were able to demonstrate with the CBCC project is that it's possible to set up in Cambodia a qualitative, affordable, and sustainable childcare. Affordable because, of course, there are some private daycare centers in Cambodia, but it's really limited to some very wealthy families and foreigners. And so most of the time, the people there is a trade-off between quality and affordability. So what we demonstrated is that it was possible to set up a center with quality and price affordable for the families. We are about to reach sustainability, hopefully. This is not totally done, but there is a commitment from the government from next year to pay third staff out of 4 in each CBCC. So that is a big step for us. And so the business model would be that so the ministry would pay for 3 staff and the commune thanks to the registration fees of the parents, would be able to pay the additional staff and the food and the different invoices for utilities and all. So hopefully next year we will have reached autonomous sustainability. And if I can say, I'm not sure it's on the slide. Also, there is a new project from World Bank. I didn't say, but the project was piloted with World Bank and funded by the people of Japan. And the World Bank is now working with the ministry, and the ministry took a loan from World Bank to set up 60 additional daycare centers in Cambodia. So it's really a spillover effect of the pilot. And yes, absolutely. We heard this morning that the Prime Minister is about to sign the sub-decree, which is the first legal framework for childcare services in Cambodia. So this is a legal framework that we've been working with the ministry for 18 months or nearly 24 months. And now it has been assessed by the different ministries, and it's about to be signed and endorsed, which is a big step also, because from this legal sub-decree, the let's say the professional sector will be able to develop itself. Of course, the children development is, we didn't put some testimonies, maybe we should have, but the parents constantly tell us that the children are, after coming to the CBCC, they are more talkative, they are more curious, they are more polite also, and they really notice the difference between before and after, and also between their children and some other children in the neighborhood. They really see the difference of the day at childcare center. And so far, for your information, we welcomed exactly 395 children. Of course, they are not all in the daycare center today. A lot of them already left. But so that makes a difference for quite a number of children. We supported, of course, the women's participation in the workforce. I mean, it's also, yes, it's also important point for the, let's say, empowerment of women. I mean, that they can return working after their maternity leave. And linked with that helps to reduce unpaid care burdens. That increased as we saw the household income, and something else, which is that allows siblings to stay at school, because it happens quite a lot in the villages. Otherwise, that the siblings, the other children from 6 to 15, they would be in charge of taking care of the babies, and they would miss the school. So it's also important for that. And the collaboration between the different stakeholders. I like to say that it takes a village to raise a child. And really here with the CBCC, we had the whole village around us, the families, the local governments, the private sector also. So it's really anchored in the community and shared between different stakeholders. And also, of course, it offered to everybody in Cambodia some practical lessons to integrate early childhood services. So, I mean, we began with this crèche, with these centers, but now we also would like to develop together with other partners and, of course, with the Ministry of Education, some daycare in companies, because there is now a demand increasing for that. And we would also like to have home-based centers in the future for the smaller villages, for instance. So we have a lot of projects to develop that, but at least we have a basis. We have something to begin with, to build on for developing that. And I thank you for your attention. So the floor is yours. You want to add something, Sapa?
No.
So if there are any questions, I don't know.
You
You're mute, Steve.
stay.
You're on mute.
If you could take the screen share down,
Yeah.
then the audience can see us better. And we can begin to take questions. Please put them in the Q&A. And I'll start off with one quick question, which is where can people find the guidelines? Are they available online? The guidelines that you spoke of for the program?
Not yet. They are not available online because there's no proper website for the moment at the ministry for the little ones. So they will be available soon because we are developing what we call a basic of preschool, which is for preschool, but we will also extend it to childcare centers. So we will be able to provide it on this platform soon, but it's for the moment it's not available. But you can ask to the ministry or to Planet Orphan Development, of course.
Okay. So they could contact you directly for that.
Yeah.
And do you also share your curriculum? Is that
We share the curriculum. Yeah. What we ask, I mean, we have a copyright. So, I mean, if people use it, it's nice to quote Planet Orphan Development and to use it entirely. But I mean, everybody can look at the curriculum. Yeah.
so? One of the most difficult challenges, I think, beyond and we'll see if we have any questions about the implementation, but you presented very concisely the challenges and how you dealt with them. But one of the challenges for a pilot and for programs moving forward is providing evidence of impact. And one of the things that stands out about your effort is that you do have evidence of impact, that this the reduction in stunted growth to zero is of course a tremendous achievement, and any country that has levels of the level in Cambodia, or in some places, of course, higher, would be thrilled to have this as an outcome. It doesn't capture by any means all of the things, all of the benefits to children and families, but it's certainly one of the most notable and a strong goal for many countries. Could you say something about what's required to do that, and advice you might have for others?
You mean the requirements to reach that result?
Because we've seen the program, the requirement, the extra efforts you need to put in place to have the measurement, so that you can document. Right. So one of the things that we find at the Khalifa Award is that many programs have difficulty documenting the impacts of their work.
Yes, so we put a lot of time on it. Actually, maybe that's interesting to share that at the beginning, we wanted to do more. We wanted to do a real impact scientific study by comparing villages or families in same situation with their children at CBCC and some other family without their children at CBCC. But I mean, that was impossible to to do so because of the slow enrollment that we mentioned. Because I mean, you cannot come into a village and say, okay, guys, now we have a center, so please register your children and wait for everybody to come. No, people were really cautious. We went, as Sopor mentioned, we had to provide a lot of information, door-to-door visit to explain what it is, why it's suitable for the children, to explain that it's not for disabled children or it's not for orphans, it's for every child. So we had a lot of time to convince the family. So of course we had pioneers, like in every new service. Some families jumped into it, especially single mothers. But for the other, it was so slow that we cannot create two groups. And we thought and we decided that it was more important to provide the services for the in-need families than to have a control group. But from the beginning, we had really in mind that we want to provide evidences about the result to be able to after that to have a model which is scalable and sellable to the government, to the companies and all. So I mean, for instance, for the income, it was a big challenge. We did a lot of discussion. We agreed with the parents. They provided us their salary sheets for us to compare before and after. So we did really with a colleague we dedicated to that. Our M&E officer for the project, he really took all the papers one by one. We collected a lot of data. We did a lot of focus group also regularly with the parents to understand why they don't put their children, what is nice with the service, how we can, of course, improve and all. So very regularly, and we still continue on doing so. Every 3 months, we conduct a parenting session meeting in each CBCC. As for the health, the bet was really to find a way to measure with the means of the commune. We didn't want to add an additional service to what is existing. We have the luck to have one health center in each commune, and they know how to grow, to monitor the growth. So each month they come to each CBCC and they monitor the growth of each child, and that's why we were able to follow the growth of the children and the nutrition status of the children.
Thank you. And are there plans for evaluation of impact with this new expansion of 60 new childcare centers?
Yeah. So that's still a project. So, but it has been signed between the World Bank and the ministry. So that is it. That is a big impact. That should be done quite quickly in 2 years. So they take the model that we developed together, and they're about to roll it out in different provinces. We hope to be selected to be the trainers because they will publish a call for implementing partners to recruit and to train the caregivers. As for the design of the CBCC and all that we did at the beginning in our team, we provided that. So the construction team of the Ministry of Education is doing it on its own. They don't need us anymore. So it's also an impact because we always try to push for institutionalization. And so that's great because now they are able to build some centers, and they don't have enough trainers. So I think we'll be asked to do so. But it's one of the project also. We also mentioned it. We would like the government to set up a center, a training center, For the moment, it doesn't exist. So we in PND are still in charge of the new trainings. For us, it's nice, it's interesting, but of course, at the end of the day, we would like them to be autonomous also. Yeah.
Thank you. And another question from the audience. How did you develop your pedagogy, your curriculum?
It was a collective work. So we didn't do it from scratch. We have an expert in the team of PND who is in Paris. She's an ECD expert for crèche, especially for nurseries. And she worked together with another expatriated expert. She was from Poland. She left the team now. And so together they drafted some the guidelines, the pedagogy. But I mean, we were inspired by the learning by playing pedagogy, and also Montessori and a kind of pedagogy. We really believe in the concept of adult as a role model, but also providing the lighthouse. So that means the adult is here to guarantee the safety of the children, of the babies. They are very small, but they let the babies also play by themselves, and of course crawl on the floor and take some toys and organize by themselves. And also it's a really free playing pedagogy, but which is inspired by existing pedagogy. Then, of course, we worked with our Khmer colleagues, because I mean, it was like a Western kind of pedagogy so far. So we really afterwards also collaborate with the ministry, the ECD department of the ministry, and also some local CSOs to come up with something which is something that we believe in, but with the specific Cambodian touch that we need. For the song, for instance, for the games, I mean, we have to put some Cambodian cultural context in it. So this is how we did.
Thank you. You spoke about expanding to different types of centers, to home-based, and one of the questions that I think arises when you think about doing that, but also if this were to be transferred to other contexts, is the extent to which the costs are feasible at a smaller scale. And I imagine you've thought about that. Do you think that's an issue, that it needs a certain scale to be low cost enough to be feasible, or that it's readily transferable to a smaller scale without raising the costs? Does the question make sense?
I think I understood the question. You mean in a smaller scale, in a smaller center? You mean for
Smaller
less
center or
children?
homes?
Home-based.
Yeah. So I think now that we have the basis once again, that we have the pedagogy and all, it's possible to adapt to smaller units, let's say. And especially, well, we believe, because we do it also in Burkina Faso, in PND, we believe also in the really the home-based center, if I can say, where a woman, most of the time, would receive some children at home, sorry. But so she would receive the same training, she would receive the same coaching. We don't want to compromise on the quality. but we can have something cheaper in terms of equipment, for instance, and we can just provide the minimum renovation for the place to be safe, to be joyful, to be well equipped. It's not very expensive. I think we don't have to build necessarily a fancy building. That now that we have the pedagogy and the curriculum and all, it's easier to train some people to take care of maybe 5 children, up to 10 if there are 2 people. And that would be at the same time a source of employment for some women, and also a way for the neighbors to have a place to put their babies. So that can be also cheaper, maybe for the parents. And because here in CBCC, it's true that we address essentially formal workers, essentially garment workers, so they have a stable salary, because $45 is not nothing. So we think that we should also provide affordability for other kind of workers. So that would be through maybe home-based centers.
Because I think about parents, for example, who work in a market,
Yeah.
and their income may vary from day to day, week to week, maybe even month to month.
Yeah, absolutely.
Yeah.
Yeah, so if we create smaller units at home, for instance, it can be also more flexible in terms of service provided.
And the trust.
The trust first, because I mean it's really important for the people that the caregivers belong to the community, more or less, and at the beginning at least, and also yeah, they can provide maybe service for the morning only, if it's what they need, what the neighbor need, or maybe 2 days a week or 3 days a week, depending on the situation of the family. So that allows also to have a more
Flexible and
flexible, a lot of proximity with the people, and so flexibility in the service. But we recommend, and this is the work we do with the ministry at the moment, to keep the quality, the training, the coaching, and the advisory committee behind the commune, looking at the home-based centers to guarantee also the transparency, financial transparency, quality, and all.
I think that this putting quality first is
Yeah.
an important aspect of, and it comes through in your message.
Yeah.
I also though think about if I would worry if the service is 2-3 days a week or only the mornings, that the 3 meals a day for some children is very important, and I don't certainly in our context in the US, I don't think people quite understand how important it is that a program provides adequate nutrition to a child every day, or at least
Yeah,
every work
absolutely.
day.
Yeah.
To me, that seems like a tremendous accomplishment.
Yeah, no, you're right, absolutely, and especially because I mean there is junk food everywhere at countryside now, and yeah, it's really difficult for the grandparents, for instance, to prepare a very good meal. So we also think about providing some meals. We tried to sell some meals for very cheap, even for dinner, to some families who are really busy, but it's a small success, to be honest. Once again, it's a change behavior. But yes, I think it's really important to provide good food, of course. Of course.
Yes,
It's a beginning there.
we start to initiate like complimentary food for children after 6 months, and parent can be buy from our daycare center with a cheap price. We can say affordable price because they are very hard to prepare. Sometimes take a lot of time to prepare complimentary food. But if the existing in the community, they can buy it. They can buy it for the children. So that is why we try to propose this service for the community to promote the nutrition for children.
I think that people would be very interested in this new approach, this extension of your
Yeah,
work here, because as you noted, this is a global problem. And
Yeah,
I suspect you can't find a country where it's not just the adequacy of calories, it's the quality of the nutrition and the ubiquity of junk food that is creating health problems everywhere.
yeah,
So this, I
yeah,
think, is
absolutely.
that we would be glad to help um, uh, provide greater attention to this aspect of your work as part of the Khalifa Award family.
Nice.
nice.
Thank you. Yeah, yeah, no, yeah, I believe it's really so important. Yeah.
And I'm going to ask one more time if we have some last questions. Uh, I don't see any yet, but if there are parting words that you would like to offer the audience, I also offer you the opportunity to add whatever you would like as we conclude our session. And thank you so much for being here.
Thank you very much. So you asked me to have a word if I want. That's it. Huh? Well, of course, I didn't thank the Khalifa Award for Education at the beginning. So first of all, thank you for the prize and for the audience. I think what I would like to say once again, it takes a village to raise a child, and I think it's really a nice approach, and maybe the unique approach um, is to gather the good stakeholders around you when you want to do something new, and that's a big lesson also from the program that. Having all the stakeholders around and having anchored the program in the community was the key of the success of it. Ah, we don't hear you anymore.
Is this working now?
Yeah.
I'm sorry, my headset died.
Ah,
There's always
no
something.
battery.
Uh, so I want to thank you again for joining us for this webinar. To reiterate that the webinar recording will be available on YouTube. And thank our audience for joining us. And hope to see you again before too long.
Okay, thank you,
Thank
Steve.
you.
Thank you,
Goodbye,
everybody.
everyone.
Thank you.
Bye.
Bye bye, everyone.